This procedure restores the health of thousands of women in just a few minutes. Now you will see the stages of one of the most popular minimally invasive procedures, uterine fibroid embolization. The procedure begins with the insertion of a needle into the left radial artery through a small puncture under ultrasound guidance. Once reverse blood flow is detected, a micro guide wire is inserted through the needle, after which the needle is replaced with a thin introducer tube. Once the tube is properly positioned in the artery, the micro guide wire and syringe inflator are removed. A mixture of vasodilators is then introduced through the tube to prevent arterial spasm, followed by the infusion of a solution that prevents blood clot formation. Next, using a catheter and guide wire inserted into the left radial artery, the doctors advance toward the aorta, then to the internal iliac artery. Once the catheter reaches the beginning of the iliac artery, a long, thin needle is inserted through the anterior abdominal wall for a block of the hypogastric nerve using a special anesthetic solution. After the block is administered, the needle is removed. The micro guide wire is then replaced with a microcatheter, which is advanced into the uterine artery. Avoiding unwanted collateral vessels, embolization of the uterine artery begins by injecting specialized substances. These substances block the blood flow until a significant reduction in blood flow is achieved. Once the procedure is completed, the microcatheter is advanced into the opposite internal iliac artery to treat the second uterine artery. The process is repeated. Unwanted vessels are bypassed, and similar substances are injected until blood flow is halted. At the end of the procedure, all catheters and guide wires are removed. The infusion of saline solution is stopped, and the patient's wrist is elevated. A cuff is placed on the puncture site, filled with air to control bleeding. The cuff is then gradually removed. Uterine fibroid embolization is an effective and safe procedure, allowing the problem to be resolved without the need for open surgery.